Hi, I'm Maya, and this is the process of discernment. Gather all relevant factual information. There's a 41-year-old female, 15 weeks pregnant. Fetus has been diagnosed with anencephaly at 15 weeks. Baby is, according to the doctor, essentially brain dead with no cognitive function, never able to think or talk. Baby will die within 1 week of birth if carried to full terms, but the condition poses no serious threat to the patient, Stacy's health. 2, identify ethical issues. The doctor suggests terminating the pregnancy because the baby is already brain dead and will die within 1 week of birth. To abort the baby at 15 weeks or to carry to full term, even though the baby won't live. And some of the nurses are trying to pressure or argue Stacy into carrying the baby to full term because the baby should be given the chance to live as long as possible. Step 3, consider what right relationships require and what leads ultimately to human flourishing. It was morally ethical for the doctor to disclose the truth to the patient, even though it wasn't the best news. I'm sure it was emotionally and psychologically traumatizing. The doctor showed virtues of respect, honesty, courage, and integrity despite the situation. However, some of the nurses have not shown these virtues, and they've instead pushed their own thoughts and feelings onto the patient. Step 4, brainstorming possible options. The patient can either terminate the pregnancy because the fetus won't have a quality of life, or the patient can carry the fetus to full term, trying to give the best quality of life until death. Option number 5, weigh the options and select one. The options: if the patient terminates the fetus, they might have psychological trauma from all the what ifs, what could have happened. If the patient carries the fetus to full term, however, they also might have psychological trauma, emotional trauma, from the knowledge that the patient is growing a dead or soon to be dead baby. The patient might miscarry before even giving birth. Either option carries emotional and psychological trauma for both the mother and the husband. It's a tough decision. Step 6, evaluate the decision against external and internal criteria. If chosen to terminate the fetus, the parents, more likely Stacy, will have to face moral, ethical dilemmas. She'll face stigmas, potential religious backlash. She will face emotional and psychological trauma. And then if she chooses to carry to full term, she'll still face all of the above. Either way, she'll have to deal with people giving their opinions, whether she wants them or not. Now, the discussion questions on page 118. Do you take the side of the nurse who argues that the fetus should be given the chance to live as long as possible, even if only for the remaining months of the pregnancy? Or the nurses who argue that the pregnancy should be terminated because the baby will die anyways? What would you do if you were this woman or her husband, and why? Well, for the first part, neither. I'm not going to choose either side. It's not my place as a nurse, as a medical professional, as a healthcare person. It's not my place to make a decision for a patient, whether they want to carry to full term or whether they want to terminate a pregnancy. That's their decision. I'm not going to try to sway you any one way or the other, especially because I don't know what I would do if I were in that situation. I honestly don't think that I could answer that question. I could give a BS answer and just say something. But I think until I was faced with that very same dilemma, I would have no idea what way to go, what way to lean, what option to choose. Neither option is a good option, and you really just have to kind of trust your gut, trust your instinct. You know what's right for you. And I can't make that decision for Stacy or her husband, nor would I be able to make that decision if I wasn't actually in that situation. I don't think I can make that decision.